I'm here in the Antelope Valley at one of many food distribution sites to help alleviate food insecurity, a problem that affects 400,000 residents, or 1 out of every 3 people in LA County. Despite signs of a rebounding economy, stubborn inflation and high costs of basic goods and rent keep many families in the red each month. That is where LA County's Department of Public Social Services, or better known as DPSS, steps in, partnering with other agencies like the Department of Public Health to provide food at sites like this one. DPSS administers the food assistance program known as CalFresh and helps low-income residents apply for Medi-Cal, among other services. It also plays a major role in the county's poverty alleviation efforts. Welcome to One-on-One, where we dive deeper into the issues of our time with the county leaders driving solutions. In this episode, we sit down with the director of the Los Angeles County Department of Public Social Services, Jackie Contreras, to talk more about how DPSS is stepping up to address the challenges impacting working families. Despite historic low unemployment and wage gains in some sectors, economic struggles persist for many low-income Angelenos living paycheck to paycheck in one of the nation's most expensive regions. And while the county's aging population is evidence of greater health and longevity, officials also project a greater demand on safety net services in the near future. Dr. Jackie Contreras stepped into the top role in 2023 and brings a unique perspective, having personally experienced many of the challenges residents face, including relying on food assistance. Leading with empathy and determination, she believes DPSS can make a tangible difference in the lives of clients. We asked Director Contreras how her department plans to tackle the daunting challenges ahead. We are here with Dr. Jackie Contreras. She is the director of the Los Angeles County Department of Public Social Services. Thank you so much for being here today.
Thank you so much for having me.
We know your department helps so many people. In fact, almost 1 out of every 3 LA County residents receives services from DPSS. That's about 4 million people. So talk to us about the services that DPSS offers our residents.
Yeah, so we offer a wide array of services. We administer federal, state, and local programs. So we provide for no cost or low cost health insurance. We provide for food assistance. We administer cash aid programs, both for families and for single adults. We also administer the in-home supportive services program, which allows individuals to stay in their homes who would otherwise be hospitalized. And then we provide assistance to immigrants and refugees as well.
Right. And we're going to go into each of those programs a little more in depth, but let's talk about food insecurity, which we know is a huge problem here in LA County, especially for low-income families. It affects more Black and Latino communities. As a matter of fact, a recent USC study said that about 30% of LA County residents are facing food insecurity, and 38% of Black and Latino communities are affected by this. So how is DPSS stepping up to help?
Yeah, this is definitely an area that we're very focused on. We nearly provide CalFresh, which is our primary program, to almost 1 million LA County residents. And we know that there are a significant number that would be eligible for the program that are not yet accessing it. And so we do a lot of outreach. We recognize that there's stigma sometimes associated with receiving public benefits, and so we're trying to change that narrative so that people feel comfortable coming forward and getting support. And we're working on building more trust with our community as well, so they can come forward and access the resources.
We know CalFresh is a really popular program here in LA County. So how does it work? How are you eligible? And what does CalFresh provide?
CalFresh provides a food subsidy, so dollars that are added to your EBT card in order to be able to access groceries at a grocery store. Many farmers markets also accept CalFresh. We also have a restaurant program that people can accept, that will accept CalFresh. And your eligibility is based on your income and the number of individuals in your household. We, the county, have a number of food distribution centers in many high-need communities, so that's another way to access.
So how are you reaching underserved populations to educate them about the availability and the enrollment for CalFresh and other programs?
With COVID, the county received a number of ARPA dollars to be able to better serve our communities. So we are partnering with 25 community-based agencies to try to increase the CalFresh enrollments. Many people remember when this program was food stamps, and they don't remember that fondly. I actually, as a child, remember standing in line waiting for food subsidies. So, you know, flour and bread and canned meats and those kinds of things.
I feel like there's also been a campaign, whether intentionally or unintentionally, to destigmatize receiving food assistance.
The program has evolved over time so that now it's on an EBT card and you can utilize it in any store as you would a credit card or cash.
You as a youth were a recipient of this program.
Yeah, of this program, of healthcare, so the Medi-Cal program, employment programs. I was very fortunate in being able to access a number of the benefits that I'm now responsible for administering.
One of the other major programs that your department oversees is Medicaid.
So Medicaid is the federal name for the health insurance. We put our California touch on everything, so Medi-Cal is what we administer. Medi-Cal provides access to regular health screenings, preventative care, mental health services, dental and vision care, and covers hospitalizations and prescriptions. And eligibility is income-based, so it depends on the number of household members and household income. Medi-Cal customers should make sure that their contact information is current on benefitscal.com. We recently had a really exciting expansion of Medi-Cal. So anyone, regardless of your immigration status, as of January 1st of this year, are eligible for Medi-Cal. And so this is the first time, I think, ever that we've been as close as we are to universal health care. We also know, like our other programs, that there are a lot of individuals out there that would be eligible for Medi-Cal that have not necessarily applied.
Why do you think it's important for immigrants, regardless of their immigration status, to receive Medi-Cal?
It's critical for everyone to have health insurance. When someone gets sick, if you don't have insurance, there are higher costs for emergency treatment. With the Medi-Cal insurance, they're able to get well doctor visits, medications that they may need, dental care. So there's a lot that can be done from a preventative standpoint if they have insurance established. We make every effort to ensure that we reach our immigrant populations by developing communications and providing translation services in 10 threshold languages. We have many mixed status households who are often afraid or unsure if they can or should apply for benefits for themselves or on behalf of their U.S.-born children. So we work very hard to inform, reassure, and encourage them to apply.
Let's talk about in-home supportive services. What is the program all about?
This program is near and dear to my heart. My mother is 96, so I have a really good sense of how critical it is to provide supports to the population of aging individuals. I believe estimates are that by the year 2030, we'll have the highest number of individuals 65 and older that we've ever had. So the in-home supportive services allows for people to stay in their home by providing the kinds of supports that they need. So that could be support with grocery shopping, taking someone to the doctor, meeting their sort of daily housekeeping needs and daily supervision. The idea is that if without these supports, they might have to go into institutional setting, which would be more costly, which would separate them from their families. And so the IHSS program really works hard, and our social workers work really hard to help maintain people in their homes and provide them the supports that they need. The program serves individuals who are aged, so 65 and older, blind, or disabled. You have to have Medi-Cal. Our estimates are that between 70 and 80% of our providers are family members. And so this allows people to stay connected to their family and to be able to be supported.
Another relatively new program that DPSS is part of is Breathe, a guaranteed income program that is really revolutionary in many ways.
So the Breathe program is actually a county-wide program. Our department is administering a guaranteed income program for our transition age youths. We're serving 300 young people. It's a 3-year program. And so we're partnering with researchers to really look at what the benefit is of that program. What we're seeing by being able to give youth these dollars is we're seeing a higher level of engagement. We're seeing more hope, quite honestly, to figure out what it is that they want for their lives. The information that it provides is going to be really valuable for us to be able to think about how we administer public benefits.
And it's $1,000 a month?
It's $1,000 a month for 3 years, yeah.
And how do people get selected?
People applied to be part of the program, and then we selected people randomly.
You mentioned your mom is in her 90s, and I'm sure she is so proud of you because of where you came from and where you are now, and now you're helping other people that were in your situation.
My mom was the oldest of 10 growing up and was the primary breadwinner for her family. Grew up in the central San Joaquin Valley. She started working in the fields when she was 14. And so she worked with the men's crews because she was the provider for the family. I think she understands now how critical the public benefits were. She unfortunately, experienced a lot of discrimination in accessing services, and I witnessed a lot of that. And so, we talk about the fact that I am determined to make our services available, to everyone in our community, and to change that stigma, and that we have compassion for our neighbors who are in need, and that we provide them the services that they're entitled to and that are available to them. One of the programs that we administer is our toy loan program. It was established in 1935 during the Depression, and we are very proud of the program that provides toys to kids across LA County. So this is our central center. So it's brand new. Unfortunately, last year we had a fire at our primary location and we lost all of our inventory. So we just moved into this facility.
Well, this is kind of an example of how wide and vast DPSS services the community, right? Like from Medi-Cal to in-home supportive services to toys. So why do you think these types of services are important?
It's a way to connect to community. It's a way to give resources to kids that otherwise would not have them. This is an opportunity to borrow a toy, bring it back next week, get a new toy.
This can really change a child, right? Just knowing that someone sees them, that they matter.
Absolutely. And children have a passion for learning and imagination, and toys just help to stimulate that.
How can they receive or learn about more of the programs and how they can possibly apply or qualify for some of the ones that we mentioned here today?
We have our DPSS website, which is at dpss.lacounty.gov. And then we have several access points. You can go into any of we have about 40 public-facing offices, so you could go into any of our offices to get information, and all of that information can be found on our website. You can call our call center on Benefits Cal, which is our website where you can apply for and get information about your benefits.
The Department of Public Social Services from the outside can seem very intimidating, especially to certain communities. Is there anything that you would like to share about your department?
We have 14,000 employees, and what I am always impressed with is the compassion and the hard work that they bring every day. I want people to know that people here care, that we're here to help. There's oftentimes fear that if you access benefits, that might have a negative impact on you. I definitely want to dispel that fear. These services and benefits are here for you, and so we want people to come in. And then I want to dispel the shame that people carry. I talk about being a recipient of public assistance. I don't carry any shame with that. My mother worked hard, my family worked hard. We were doing the best that we could, and these benefits were there to support us. And so I want people to not feel that shame, and to be able to access the benefits that are there for them.
Well, Dr. Contreras, it was so nice to meet you. Thank you so much for sharing your time with us.
Thank you so much.